All right, so I'm going to talk about BCL2 mutation, which we detected in patients treated with Venetoclax. So as you probably all know, Venetoclax is a highly potent and selective BCL2 inhibitor. Counts itself as one of the most effective medications for CLL. It's typically given in monotherapy at the moment, although it's currently being trialled in combination. But despite its efficacy, the majority of patients will relapse on Venetoclax, and so up until now, we didn't really have a good idea about why people were relapsing. So, as I was saying, you can relapse with CLL either with a low-grade CLL progression, or you can relapse with transformation to diffuse large B-cell lymphoma. And so, what we looked at was patients, about 67 patients who were treated in the early phase clinical trials. These were some of the first patients treated in the world with Venetoclax. And we took 21 of those patients who had progressed whilst taking Venetoclax single agent therapy. And we did next generation sequencing on their tumour samples, both before and after progression. And what we found was in 4 patients, we found a single nucleotide variation, the Gly101V, in all 4 patients. And in all 4 patients, we were able to show that this wasn't present in their cells before they received Venetoclax. So what does all that genetic information mean? This is the BCL2 protein here, okay? So this is the sort of the business end of the BCL2 protein. It's where all the pro-survival molecules bind. And this is also where Venetoclax binds too, and this is Venetoclax here in orange. And R mutation occurs here, so this is a blown up version of the alpha-2 helix. And you can see here that Venetoclax is sitting right next to this, this amino acid. And this amino acid basically changes from a small glycine amino acid to a bulky valine amino acid. So you can imagine it sort of pushing into that groove and potentially stopping Venetoclax binding, or at least that's what we thought. Importantly, you never see this mutation in cancer otherwise, so it hasn't been described in the entire cosmic database in over 50,000 cancers. We sequenced 400 patients with B-cell malignancy in our laboratory and didn't find anyone who hadn't been exposed to Venetoclax. And this is the time course of its development in these patients. So in 4 of the patients where it was at significant level, you can see here that it essentially begins to appear from 20 months of therapy onwards, so it's quite a late mutation. But then in everyone where it was detectable, the patients inevitably progressed to overt clinical relapse and had to either come off therapy or be treated with something else. So we took this discovery into the laboratory and worked out that the patient cells with Venetoclax have up to a 30 to 50-fold decrease in sensitivity to Venetoclax. This is sort of as close as we came to recapitulating what was happening in the patient in the cell dish. We took a cell line. We gave it the Gly101V mutant, and we put it in the context of sublethal doses of Venetoclax, and you can see here that you gradually get an increasing dose of this mutation over time. This is over a 3-week period, but you can imagine this is what's happening in a patient, a gradual increase of this Gly101V mutant in the context of this selection pressure of Venetoclax. This is just the experiment showing how it works, and basically this is protein binding experiments showing that it decreases the affinity of Venetoclax for that group by 180-fold compared to wild type. So it's a 180-fold reduction in the efficiency of Venetoclax binding to BCL2, which makes it a very good candidate variant for being a resistance mechanism. And finally, importantly, it's not the only mechanism that's present in patients. So in all the patients we detected it, we didn't detect it in all the cells. The most that we detected was in 75% of cells, which means 25% of the cells which are resistant to Venetoclax are not driven by Gly101V. And in this patient, we managed to find upregulation of a molecule that's like BCL2, which is BCL-XL, which will be driving Venetoclax in those cells. So not only is there's not only one type of resistance in these cells, but this is certainly an important one. So in summary, this is the first BCL2 mutation that's been described in patients with CLL and mediates resistance to Venetoclax. It seems to work by markedly reducing the affinity of Venetoclax for BCL2. It's subclonal, and we were very surprised about the frequency with which it was observed. We observed in 50% of the patients we tested, and the fact that there was only just this one mutation occurring and not a bunch of mutations occurring in BCL2, it's just this one. one. And so basically we think this is a strong rationale for using combination therapies in the future. So this is what happens when you give a targeted agent to a genetically complex leukemia. Second of all, it's a rationale for giving time-limited therapies, as Tate was saying, that limiting the exposure to Venetoclax will limit the development of this resistance. Thanks.
Thank you.